Hello and welcome OT and PT students. My name is Dr. Norman Bilyesa, and I would like to be one of the first to welcome you to Patient Client Care Management 1. We've created this course introduction video to get you acquainted with the course syllabus and the navigation of the Blackboard and some of the course policies and procedures for the course. We invite you to watch this video, but also to read the syllabus in its entirety as it contains important information on the course structure, course rules, and how to navigate the course, and some of the important policies and procedures that you need to know in this course, but also throughout your time with us at USA.
On the first pages of your syllabus, you'll find the course introduction and also where we meet for lab and the times and dates for this term. And the course faculty are below that. You'll find our contact information and email. You'll also see that I have office hours available. Please be sure to reach out to your course faculty through our USA email addresses and also using your own USA email address, as we are not allowed to respond to personal email addresses from the university. Further along in your course syllabus, you will find our course grading policies and procedures. I wanted to take special note of the special notes section that's in the box below. Students must pass all your practicals, so you must have a minimum passing competency of 80%, and you must be 100% safe with all of your practicals. If there are any issues that are experienced as far as reaching the 80% competency, or if you have what we call an auto fail, you'll be asked to retake. And in order to pass the course as a whole, you must make sure that you pass the lab components. The second bullet point is the final letter grade. All of your grade scores are weighted. Assignments and quizzes are worth 5% per. Your practicals are worth 20% for the first practical, 25% for the second practical. Your written midterm is worth 20%, and your final cumulative exam is worth 25%. So that is a weighted total grade. What the second bullet point says is once all the weighted scores are calculated, that gives you a final course grade, and that grade will be rounded to the nearest whole number. In the end of the course, if you have an 84.5%, that will be rounded up to an 85%, which would constitute a letter grade of a B+. However, if you have an 84.49, that is below the rounding up, so that will be rounded down to an 84%, and the final letter grade for that is a B. There are no exceptions to this policy. The final letter grade is the final grade that will be assigned to you in the course. There are no additional extra credit points or further considerations to bring that grade up to bring you up to that next letter grade. So please note that this is a university-wide policy, and the rounding up will be as stated in this special notes box. As previously stated on the last slide, this is the weighting of the course. Your final grade has different components. You have your written exams, which is a midterm and a final, 20 and 25% respectively. Practical 1 is 20%, practical 2 is 25%, and assignments and quizzes are 5% apiece. Further on in the syllabus, you will find some guidelines as far as turning in your online assignments. Please review this in its entirety as it gives you specific information. One of the things that we allow is the submission of up to, you can submit your document or assignment up to 2 times because sometimes students forget to include information. One of those things is proper citation and referencing. Please make sure that you follow the university guidelines as far as proper citations. If using our website, such as the course Blackboard content or video presentations, you can cite Dr. Bilyesa, myself, as the author for that resource. And please follow the proper way of citing a website or online content when putting that in your references section. We wanted to take a moment to talk about the practical retake policy as stated on the next several slides, but also please refer to the student handbook for more details on the retake policy. A retake is asked of a student in a couple of instances. For example, if a student does not receive enough points on the rubric to achieve 80% for that component. The second instance is if a student has what we call a critical safety item that is identified or an auto-fail item that is identified. Examples of this could be infection control issues, improper patient handling or safety, or not putting on a gate belt or locking a bed or wheelchair. All of these are examples of what we call critical safety or an auto-fail. If a student is asked to do a retake, we don't want students to think of this as a negative reflection or to cause increased anxiety for the student. Rather, a retake is a way of flagging particular areas so that a student is made more aware because of competency or safety, because we want to make sure that these things occur in your practice, and that when you go into clinical rotations and working with patients, that you have these skills at a competence level and at a 100% safe level. The first retake procedures are a little less formal than the second retake. If you're asked to retake, which we call your first retake, you'll send an email to the course lead instructor that will describe the feedback that you received from your grader. The second thing to consider is describe how you'll prepare to be successful in your first retake. And the third thing is to reflect on what impact it may have on yourself as a therapist or on your patient for safety. You'll submit that email and your instructor will review it. If that remediation plan seems appropriate, the faculty will then schedule you for your first retake when that schedule is available. If you pass your first retake, then you will receive a maximum score of a 75% for that practical exam. For your second retake, the policy stated below in the next couple of slides is a little more formalized, and your course instructor will work with you to help you fill out formal documentation that needs to be filled out. You will also, once you work with your course instructor and they approve your documents, those will be sent to the APRC, which is the Academic Progression and Retention Committee. Dr. Joanne Laslovich is the chair of the APRC committee. They will review your formalized documents to make sure that your remediation plan seems sound and that you would be successful to move forward. The reason why this is a little more formalized is we want to make sure that you're working with your course instructor, your academic or your faculty advisor, and also if you need to work with the student services or student success services coordinator, these resources will be made available to make sure that you are successful in your second attempt. In your second retake, once you're approved by the APRC, you'll be scheduled to take that retake, and if you pass that, you will receive a maximum of 70% for the score for that practical. If you do not pass after a second retake, then you will receive either a D or an F grade, depending on how your final assessment is for the overall course. Receiving a D or an F will constitute a need to retake the course, and also will have modifications to your schedule in the following term. Another guideline or policy and procedure that we'd like to draw attention to is our professional behaviors. Professional behaviors are an important aspect of your development here in the program. We want students to start building those skill sets, those technical and non-technical skills that help shape who you are as a student and as a clinician. Professional behaviors can be how you interact with your fellow classmates, how you interact with your faculty, and the university staff and administration. Some of the identified areas of professional behaviors are included in the bullet points, but there are also things that go above and beyond what is stated here. Some examples are how you communicate via email or how you communicate face-to-face with your fellow students or faculty. Also, how you conduct yourself in class, your attendance, professional dress, professional behaviors, and adherence to any of the university policies and procedures. Students who are exhibiting difficulty with some of the professional behaviors, if there are behaviors that are significant, they can be referred to the Professional Misconduct Committee, which is the PMC. The Professional Misconduct Committee hears particular cases if they are referred to by faculty or staff or by students. and the Professional Misconduct Committee can make additional penalties against a student, such as requiring additional coursework, dropping of the final letter grade, or any other areas that can be recommended by the Professional Misconduct Committee. There can also be recommendations for suspension or dismissal from the program, depending on the severity of the professional misconduct. For PCCM1, this course, the late assignments or penalty for any quizzes or assignments is a 20% deduction. If that does not meet the deadline for the particular coursework, a 20% penalty will be assigned to anything submitted after the due date and time. On this slide and within your course syllabus, you'll note the sections of your mid-course warning and your withdrawal date. The mid-course warning is the date as indicated on your current course syllabus, and this serves as a way of communicating in the term and in all your courses. At the midterm of the course, you will get a communication of your current standing and your grade up to this point. Any students who are at a 70% or near a 70% or below the threshold will receive a communication from the course instructor or from the registrar to give a student a heads up of their current progress. What this allows is for the student to know if they're progressing well, if they're at risk for non-passage, and gives the opportunity for students to be made available to the academic advisor, your faculty advisor, your student success coordinator, and additional resources such as group tutoring or private tutoring to help you be successful in the course. The university wants to make sure that all students progress and are successful in moving forward from their course into the next term. And so the mid-course warning will be issued to allow the students to reflect on their grades and look at their current standing if they need additional services. The withdrawal date is as indicated in your current syllabus and the date that is posted there. The withdrawal date allows students to drop out of a course. If they do it before the withdrawal date, they will receive a W on their transcript. The W stands for withdraw, and that allows the student to retake the course in the following term. However, because of the retaking of the course, the student will have a modified schedule in order to accommodate that class, and will have a reduced schedule for the coming term. If a student does not withdraw and they continue in the course and receive a non-passing grade as a D or an F letter grade, the student will have additional academic penalties that are described in the faculty or in the student handbook. Please refer to the student handbook for the policies and procedures regarding receiving a non-passing grade. However, if the student receives a W, that does not carry the academic progression penalties that are equivalent for a non-passing grade, such as a D or an F grade. On the last pages of your syllabus are the course schedule and the week-to-week modules and recommended readings and review of units for the course. Please follow the schedule closely as it gives you good recommended pacing through the content and also preparing you for future labs in the class. One of the areas that is a little confusing for students is the special note on this particular box above your course schedule. Please note that the BlackBoard is based on Eastern Standard or Eastern Daylight Time, and that's because of our multiple campuses. BlackBoard needs to be based on one time zone, and so we have based that on University of St. Augustine and University of St. Augustine campus and Miami campus, which is on the East Coast. What that means is when you turn in your course quizzes or assignments, you will be time-stamped based on Eastern Standard Time. So for instance, if you turned in your due assignments or quizzes on 9:30 Pacific Time, that actually timestamps it 12:30 Eastern Standard Time. At that point, you'll actually see a late message on your assignment or quiz. Please note that we are going to make the adjustment and you will not be given a late penalty so long as you are turning it in by before midnight Pacific Standard Time. In order to avoid confusion, we ask students to submit their work before the Eastern Standard Time Zone to avoid any confusion. If you have any questions, please feel free to reach out to Dr. B about how this policy works out. Also, the modules are done a little bit out of sequence. You'll see that we are going to start with Module 8 this week, working with wheelchairs and the features and fittings of wheelchairs within your first week of lab activities. As you go through the last pages of your syllabus, you'll see the week-to-week breakdown. You can see that for this week, you have some pre-lab preparation. So go ahead and start reviewing Units 1 and Units 8 on the left-hand side of the course navigation page, and also Chapters 1 and Chapter 7, which is the intro to the course, and also getting you acquainted with the wheelchair features. As you see, there are assignments and quizzes due throughout the week. They are usually due on Friday or Sunday, so please follow the schedule closely so that you are not you're not getting behind on the courses and assignments and quizzes. The assignments and quizzes helps you to stay on pace so that you don't get behind with all of the information as you're going through the course. We're looking forward to working with you this week for your first class and also throughout the term in your Patient Client Care Management 1 course. If you have any questions, again, please feel free to reach out to Dr. B as the course lead instructor, and we look forward to seeing you on Thursday afternoon. Please be prepared for class in proper lab attire, which is described in your student handbook, and we're looking forward to seeing you then. Thank you so much.